Missouri has gotten nearly $3 billion since the year 2000 from a landmark settlement between 46 U.S. states and the nation's largest tobacco companies.
That settlement was aimed at providing relief and rolling back the negative public health effects of its products. Tonight, in an ABC 17 Wastebusters report, Joe McLean is breaking down how Missouri is using or misusing that settlement money. Joe?
Yeah, Missouri got more than $138 million from that tobacco settlement just last year. Well, what we found was that almost none of it is being used for tobacco prevention. The state and the nation is in the midst of a powerful new smoking trend, e-cigarettes.
Our adult data is showing a decrease in combustible tobacco use. But at the same time, we're seeing a significant increase in electronic cigarette use.
This in the 20th year since that nationwide landmark settlement, which was aimed at, quote, reducing underage tobacco use by discouraging such use and by preventing youth access to tobacco products. Right now, there are two Missouri departments that are working to curb the use of tobacco. First, the Department of Mental Health. This year, DMH will spend about $91,000 on fighting tobacco use, about $66,000 of which will come from the multi-million-dollar settlement. Then there's the Department of Health and Senior Services. Valerie Howard is its comprehensive tobacco program manager.
We try to keep people from starting to begin with, and for those that have already started, trying to help them quit.
DHSS oversees a variety of programs aimed at preventing young people from using tobacco, helping addicts quit, and working to eliminate public exposure to secondhand smoke. DHSS also runs the state's Tobacco Quit line.
The more money you have, the more you can do. So I think as a program, we do the best we can with the limited resources that we do have. But obviously, if we had more funding, we would be able to do more and probably impact more.
Of the $1.25 million that Howard will be given to run these tobacco prevention programs this year, only about $71,000 is coming from the state of Missouri, and zero of it is coming from the tobacco settlement.
I can say that our department, our tobacco control program, does not receive any settlement funds. I can tell you that. As far as how those funds are being used by the agencies in Missouri that do receive them, I can't really speak to that.
So where is the settlement money going? According to the Office of Administration, nearly 3/4 of the funds are funneled into Medicaid. Nearly 20% goes to the Department of Elementary and Secondary Education, and the remaining 8% is sent to various offices such as Administration, Social Services, and the Department of Public Safety. Mo Health Net, the state's Medicaid program, does offer unlimited tobacco counseling services to help people quit smoking, but it's unclear how much of that is funded through the tobacco settlement.
Joe McLean, thank you. You can see all the data used in this report in an interactive format on our website at abc17news.com. While you're there, you can also let us know your ideas for our next ABC 17 Wastebusters report.